Public schools in San Francisco partnered with a local hospital's adolescent gender center for at least the past 4 years in order for their teachers to receive training on how to interact with transgender students. Now, the trainings, which came to light due to a Freedom of Information Act request from the organization Parents Defending Education, included role-playing scenarios on how to arrange gender counseling for minors without parental consent. Now, what else did these internal documents reveal? Joining me now to discuss it is Alex Nestor. She's an investigative fellow with Parents Defending Education. Alex, welcome to Washington Watch.
Joseph, great to be on with you.
Now, first, tell us what prompted you guys to file these FOIA requests in the first place.
So this is something that I think has become a huge issue that we're starting to see a trend across the country is gender clinics becoming, involved with local school districts. We saw this first with the Children's Hospital of Philadelphia. In this case, the gender clinic there was giving presentations to school districts across the state of Pennsylvania. And these, trainings specifically told teachers and district administrators to not tell parents when their kids decided to change genders. So after we saw that FOIA, we decided that, maybe it would be worth FOIAing other districts for their relationships with gender clinics. And this is another one that we found, unfortunately.
So essentially what you found in San Francisco is what you expected to find?
When it comes to these things, I never quite know what to expect to find here. But yes, we saw in this case, the district brought forward some real examples of issues that they've had with children in the district that are experiencing gender dysphoria. They brought them to these practitioners at the clinic to, work through with them. This was way back in 2018. And what we saw was exactly what you said in the introduction. This gender clinic specifically asked the school counselors in this district how they can get kids mental health training without parental involvement or consent. So unfortunately, yes, this is sort of what we were expecting to find, unfortunately, in this case.
Well, also, unfortunately, it seems that these are not isolated incidences, and it's not just kind of rogue children's hospitals doing this. And in fact, from the highest levels of our government, this sort of activity has been encouraged. Here's Rachel Levine, who, of course, is one of America's most famous transgender individuals, Assistant Secretary for Health and Human Services, calling for doctors to be trans ambassadors. This clip is from September of this year. Let's play clip 4.
I encourage all of you to think of yourselves as ambassadors to your communities, ambassadors for science, ambassadors for compassion, and ambassadors for care. These conversations don't have to be limited or restricted to a medical setting. Offer yourselves as informational resources, not just for youth, but for school teachers, principals, school boards, professional organizations, recreation centers, county commissioners, and others who would benefit from this information and your perspective. Please proactively seek opportunities to speak about what you know.
Alex, does it seem likely, you've talked about Pennsylvania and now San Francisco, but do you think this is likely happening all over the country where children's hospitals are actively working with the school district to do things behind the back of the parents?
Well, Joseph, I can certainly tell you that this is happening elsewhere, and it's just going to take a lot of time and a lot of work to find these, to file the FOIAs and find the documents and figure out what's going on. And look, let's note the years here. In this case, this relationship between the gender clinic and the school district started 4 years ago. So they have quite a head start on us, but we're working hard to catch up with them.
Alex, undoubtedly there are parents who are hearing this, watching this right now, and they're outraged at the possibility, because this is not something we're unfamiliar with, right? Because Planned Parenthood has had this relationship not for 4 years, but almost 40 years in some cases with school districts, where they have been creating the curriculum, working with school districts to provide abortions in many cases for children behind the backs of their parents. Now it looks like this is happening on the trans issue as well. What are you recommending for parents?
Well, look, a silver lining from the pandemic was that parents really started to get involved in their schools, and we really encourage that. We want parents to show up. We want parents to ask questions. We want parents to file public records requests, and we're happy to help them do that. Look, more than anything, it's important that parents know what's going on in their kids' schools and in their kids' lives. They have a right to. They're the people who care about kids the most. And we encourage and want to support parents in their effort to do that. So yeah, parents should get involved. They need to know what's going on. And if their school district won't tell them directly, then they have a right to file public records requests and figure out what's going on. And we're happy to help them do it.
And let's talk about that briefly, because that probably sounds daunting to people. Many people don't know what a public record request is, much less how to fill one out. Somebody might be inspired to do that. What steps would you recommend they take? How can they get in touch with you? How difficult is that?
You can get in touch with us at our website at defendinged.org. But to file a public records request, it does seem very daunting, and it's really not. Your school district should have a public records officer. Their email should be available on your district website. And if it's not, you can email the superintendent's office or someone else at your district to figure out who the right person is to send that information to. Each state has their own laws, so we recommend that parents and others sort of do a little bit of digging on what their public records request laws look like in their state. That can be a little daunting too. But like I said, we're here and we're happy to help. You can find us at defendinged.org and get in touch with us there.
Alex, as you're breaking this story, do you have any reason to believe that this will change the behavior of the children's hospitals involved here?
That's a really good question, and one I'm afraid I don't necessarily have the answer to. I think what's most important is to shine light on these issues. I think in some areas, sure, this might scare gender clinics away, but I think, as a society, we're kind of trending toward this more and more. And you can see that by the number of gender clinics, specifically pediatric gender clinics, that are popping up all over the country. So I'm not quite sure if this trend is going to stop anytime soon, but it's really important to expose what's going on so parents know what districts are doing this, what their kids are being exposed to, and know that they have options there too to send their kids elsewhere potentially, or just fight back when it's going on in their kids' schools.
Alex and Esther, Parents Defending Education. Thanks for your time today. Thanks for what you're doing. And I know we will talk again.
Thanks for having me.